What can people watching this do to help further Children's Cancer Research Fund's goal to make survivorship easier?
The goals of CCRF of looking at long-term survivor complications, looking at current treatments and how to treat children better who have cancer is going to have a long-lasting effect on many lives. Not only the children who are going through the cancer treatment, their parents, their siblings, their whole family, everyone around them. And when you're looking at treating the child with the cancer, you're missing the bigger picture, that you're actually treating a whole family system and everyone else around them for the rest of their life. I think with my story in general, I think having that transition period when I was going to college and trying to figure out what my history was as far as what I was supposed to be doing, I eventually had to ask for my records from the Children's Hospital and try to read through the paperwork myself to really understand what medication I got, what surgeries I had. So one of the biggest things that I think about when it comes to survivorship and trying to go into adult life is having an understanding of what happened, what happened to me. So much of what I did was following my parents' lead and letting them take care of all the details, that then when it came time for me to take care of my details, I didn't know the details. And I didn't know who I could ask or where to go to. And so having a childhood cancer survivor clinic and long-term follow-up program with research would be so important, because there's nothing at the time I was going through that would have helped me, because there was no one to look to.
In this day and age, with the technology and the electronic tools that we have, what would have been helpful at that time in your life as a college student to be more connected to your medical history, your treatment? What would have been on hand, easy, and just a tool for you to have?
Well, I think part of the challenge was that I had to request paper records that were on microfiche and trying to read through those and decipher the language and the writing that was on there. So certainly electronic medical records nowadays would have a great benefit that you can actually see the words and actually can open up a MyChart account that's on there. But also, I think having someone who is there I could go to, a physical person, whether it be at a clinic or a virtual visit, or someone could just follow up with. We have so much technology advances right now that make healthcare easier for access. Those tools have been great to have.
Connor, what can people watching this do to help further Children's Cancer Research Fund's goal to make survivorship easier?
It's by helping each other out and make everyone feel confident in each other and have sympathy for each other, and doing teamwork and trust the ones that they're going to talk to.
That's great advice. Thank you. Anna.
Donate. And really listening to stories and just continuing to give us an outlet to talk, to share about our experiences and to share about the things that are hard now. And to hopefully, put more research into creating treatments that minimize long-term effects. It's definitely that transitional piece between surviving cancer and becoming an adult. Some contact place or the MyChart, that would have been awesome. Just something that can follow you, where everything can be in one spot.
Donations are very important, especially when looking at the federal funding that does go to childhood cancer research. It's so important to donate to organizations like this that are really putting in a lot of work, making it more okay to talk about this taboo subject of childhood cancer, because so many people are so afraid to talk about it. It would be really nice if there was a specific plan for him after treatment. I mean, he has his follow-up appointments and his CBCs, but what now? What should I be looking for? Or even having some kind of peer support group right away for him or for us as a family. Just have that as an automatic thing, because I feel like I'm more lost now than I was when I saw the specific roadmap and what medications were coming next. And now it's just, I feel like I'm just like hope for the best, and yeah, no one's holding my hand anymore, and that's hard.